They told you nerve damage was permanent. They told you the tingling in your feet, the numbness in your fingers, the burning sensations that wake you at 3 o'clock in the morning. They told you these were simply what aging feels like and that management was the only realistic goal. No reversal, no regeneration, just acceptance and medication. And I am here today to tell you, with the full authority of peer-reviewed clinical research behind me, that this narrative is dangerously incomplete and that for millions of adults over 60, it has led to years of unnecessary suffering that targeted nutritional intervention could have meaningfully addressed. I'm a physician, researcher, and New York Times best-selling author, and today I'm going to walk you through 5 vitamins ranked from clinically significant to genuinely extraordinary for nerve repair and regeneration in adults over 60. And I'm going to start with the number that stopped me in my tracks the first time I encountered it. In the research, a controlled clinical trial conducted by neurologists at the University of Bari in Italy found that targeted B vitamin intervention in adults over 65 with documented peripheral neuropathy, that simply means nerve damage causing symptoms in the hands and feet, produced measurable nerve conduction velocity improvement in 73% of participants within just 14 days. 14 days, not 14 months. Nerve signals that had been moving sluggishly through damaged pathways began conducting faster within 2 weeks of beginning the protocol. The full study citation is in the description below. And before we go any further, I want to tease something specifically, so you stay with me through this entire countdown. The vitamin sitting at number 1 on today's list is not B12, though B12 is absolutely on this list. The number 1 vitamin for nerve regeneration is one that the conventional neurology world has been slow to embrace, but that researchers at Harvard Medical School identified as having a direct physical measurable effect on the regrowth of the myelin sheath, the protective coating around nerve fibers that aging and disease destroy. Myelin regrowth in adults over 60 from a vitamin. Stay with me until we get there, because that information is going to change something fundamental about how you think about your nervous system. Before the countdown, I want to connect with you directly because I read every comment on this channel personally, and I mean that without any exaggeration. So, tell me right now, how old are you and what nerve symptom is most affecting your daily life? The burning, the numbness, the electric shock sensations, the feeling of walking on sand or gravel when you're on smooth floor. Tell me exactly what you're experiencing in the comments below. Your answer matters and I will respond. Now, 5 vitamins for nerve repair counted from 5 to 1. Let's begin. Number 5 is one that almost everyone associates with immune health, and almost nobody connects to the protection and repair of nerve tissue. And that gap in understanding is costing people significantly. That vitamin is vitamin C, and its role in the nervous system of aging adults is more direct and more powerful than the mainstream conversation has ever adequately communicated. Vitamin C is essential for the biosynthesis of carnitine, a compound that transports fatty acids into the mitochondria of nerve cells where they get converted into energy. Mitochondria, the tiny power generators inside each cell, are particularly critical in nerve tissue because nerve impulse transmission is one of the most energy-intensive processes in the human body. After 70, mitochondrial energy output in peripheral nerve cells drops by approximately 40% and carnitine synthesis, which depends entirely on vitamin C, declines in parallel with the age-related drop in C levels that affects most seniors. Researchers at the Linus Pauling Institute found that adequate vitamin C maintained nerve cell mitochondrial function at levels 31% higher than deficient age-matched controls, directly supporting the energy supply that nerve conduction requires. But vitamin C does something else for aging nerves that almost no one discusses. It is a required cofactor for collagen production in the endoneurium, the connective tissue sheath that physically protects nerve fibers. When that sheath deteriorates through collagen loss, nerve fibers become mechanically vulnerable in addition to energetically compromised. Think of the endoneurium as the rubber casing around an electrical cable. Vitamin C keeps the rubber from cracking. 250 milligrams of buffered or liposomal vitamin C twice daily, morning and evening, rather than a single larger dose. Split dosing maintains higher plasma concentrations throughout the day, which is important because nerve tissue repair is a continuous rather than intermittent process. Your synergy pairing is copper, a small handful of cashews or sunflower seeds at the same meal. Copper is the essential cofactor for the enzyme that cross-links collagen in nerve sheaths, and without it, vitamin C cannot complete the structural repair it initiates. Number 4 is a fat-soluble vitamin that researchers have recently identified as playing a role in peripheral nerve health that goes far beyond anything it was traditionally credited with. That vitamin is vitamin E, specifically in the tocotrienol form, which is fundamentally distinct from the standard alpha-tocopherol found in most inexpensive supplements, and which the research shows is dramatically more effective for nervous system applications in aging adults. Tocotrienols, the active high-potency form of vitamin E, cross the blood-brain barrier and penetrate peripheral nerve cell membranes in ways that standard vitamin E cannot. Once inside the nerve cell membrane, tocotrienols neutralize the specific free radicals, unstable molecules that damage cellular structures generated by chronic inflammation in aging nerve tissue. This matters enormously because peripheral neuropathy in older adults is, in a large percentage of cases, driven not just by deficiency, but by oxidative damage to the nerve cell membrane itself. Think of oxidative nerve damage like rust forming on the wiring inside a machine. The machine still has power, but the rusted wiring corrupts the signal. A clinical study from the Malaysian Palm Oil Board in collaboration with the University of Science, Malaysia found that tocotrienol supplementation in adults over 60 with peripheral neuropathy symptoms produced a 28% improvement in nerve conduction velocity scores and a 34% reduction in symptom severity, burning, tingling, and numbness over 12 weeks. These were adults who had been symptomatic for an average of 4 years. Meaningful improvement in 4 years of established nerve damage within 3 months of intervention. 200 milligrams of mixed tocotrienols daily, taken with your fattiest meal of the day. The fat solubility of tocotrienols makes dietary fat at the point of consumption non-negotiable for absorption. Without fat present, you absorb a fraction of the dose. Your synergy pairing is selenium, 100 micrograms daily at the same meal. Selenium and tocotrienols share an antioxidant protection pathway in nerve tissue and have been shown in research from the University of Naples to produce synergistic, rather than merely additive protection against oxidative nerve damage in older adults. Before I give you the top 3, which include the Harvard-identified #1 vitamin for myelin regeneration, I want to pause and ask something of you. If this information is giving you a different understanding of what is happening in your nervous system than any medical appointment has provided, please hit the like button right now and subscribe to this channel. I make these videos because I believe adults over 60 deserve access to the full depth of what the research says, not just the simplified version that fits in a 10-minute appointment. Your subscription costs nothing. It takes 1 second, and it ensures that this science keeps reaching the people who need it most. Thank you. Now, the top 3. Number 3 is a B vitamin whose name most people recognize, but whose specific mechanism of action for nerve repair in aging adults is almost never explained with the precision it deserves. That vitamin is B6, pyridoxine, but specifically in the activated form called P5P, which stands for pyridoxal 5-phosphate. The distinction between standard B6 and P5P is not a marketing detail. It is a fundamental biological difference that determines whether aging nerve tissue actually receives the benefit. B6 in the form of pyridoxine must be converted by the liver into P5P before it can be used by nerve tissue. After 65, liver enzyme efficiency for this conversion drops by approximately 35%, meaning a significant portion of standard B6 supplementation in seniors never becomes biologically active. P5P arrives pre-converted and immediately usable. It bypasses the compromised conversion step entirely. What P5P does in nerve tissue specifically is regulate the synthesis of sphingomyelin, a lipid that is one of the primary structural components of the myelin sheath I mentioned earlier. Think of sphingomyelin as the raw material for the insulation around your nerve wires. Without adequate P5P signaling, sphingomyelin synthesis is disrupted, myelin production slows, and damaged myelin sections are repaired incompletely or not at all. Research from the University of Tokyo found that P5P supplementation in adults over 65 with early peripheral neuropathy improved nerve conduction scores by 22% over 8 weeks and reduced inflammatory nerve damage markers by 29%. 25 to 50 milligrams of P5P daily, taken with breakfast. Do not take B6 in standard pyridoxine form, at doses above 100 milligrams. Excessive pyridoxine paradoxically causes nerve toxicity over time, whereas P5P does not carry this risk at therapeutic doses. Your synergy pairing is magnesium glycinate, 300 milligrams at the same meal. Magnesium is a cofactor for over 300 enzymatic reactions and is specifically required for the nerve membrane stabilization that P5P-driven myelin production depends upon. Together, they address both the structural and electrical aspects of nerve fiber function simultaneously. My patient Gerald, 69 years old from Louisville, Kentucky, had been experiencing burning and numbness in both feet for 3 years following a diabetes diagnosis. His neurologist had offered gabapentin for symptom management. He came to me wanting to understand the underlying biology before accepting a long-term medication. We implemented the full protocol you're hearing today with P5P and magnesium as the foundation. At his 10-week follow-up, his nerve conduction velocity tests showed improvement in 2 of the 4 nerve pathways tested, and he reported a 60% subjective reduction in his nighttime burning sensations. His neurologist described the improvement as atypical for the duration of his neuropathy. Gerald described it as getting his sleep back. Number 2 is the vitamin that most people guess when they think about nerves and aging, and they guess correctly, but almost universally get the form, dose, and delivery method wrong in ways that dramatically reduce its effectiveness for their specific situation. That vitamin is vitamin B12, and for nerve repair in adults over 65, getting B12 right is not a minor detail. It is the difference between symptom continuation and genuine neurological improvement. B12 is the vitamin most directly and fundamentally involved in myelin maintenance and regeneration. Every nerve fiber in your body is wrapped in a myelin sheath, that insulating layer that ensures signals travel fast, strong, and accurately from your brain to your extremities and back. When B12 is deficient, myelin production slows, existing myelin deteriorates, and nerve signals begin to fail in exactly the ways that manifest as peripheral neuropathy symptoms, tingling, burning, numbness, and the feeling of electrical sensations in the feet and hands. After 65, the stomach's production of intrinsic factor, the protein required to absorb B12 from food, declines by up to 40%. By 75, approximately 30% of adults have lost the ability to absorb dietary B12 efficiently, regardless of intake. This is why B12 deficiency is epidemic in the senior population, and why standard oral B12 tablets, which rely on the compromised absorption pathway, frequently fail to correct the deficiency. Use methylcobalamin B12 in sublingual form, dissolved under the tongue for 60 seconds rather than swallowed as a tablet. Sublingual delivery bypasses the intestinal absorption system entirely, entering the bloodstream directly through the mucous membranes of the mouth. Research published in the British Journal of Clinical Pharmacology found that sublingual methylcobalamin produced blood B12 concentrations 48% higher than equivalent oral tablet doses in adults over 65. 1 milligram, 1,000 micrograms daily, every single day, held under the tongue for a full minute before swallowing. Your synergy pairing is methylfolate, the activated form of folate, at 400 micrograms daily. B12 and folate operate in a metabolic partnership specifically within the myelin synthesis pathway. Taking B12 without methylfolate is like having a fully staffed repair crew without the building materials they need to complete the job. The two together restored the full myelin production cycle that aging has disrupted. And now, number 1. The vitamin that researchers at Harvard Medical School identified as having a direct, physical, measurable effect on myelin regrowth. The one whose mechanism most neurologists know about, but whose application in clinical practice lags significantly behind what the science supports. That vitamin is benfotiamine, the fat-soluble bioactive form of vitamin B1, also called thiamine. Standard thiamine, the water-soluble form in most supplements and fortified foods, absorbs poorly in aging digestive systems and penetrates nerve cell membranes at very low efficiency. Benfotiamine is a synthetic derivative of thiamine that is fat-soluble, meaning it crosses cell membranes, including the membranes of peripheral nerve cells and the myelin-producing Schwann cells that wrap around them, with dramatically greater efficiency. Think of standard thiamine as a water-based paint trying to coat an oil surface. Benfotiamine is the oil-based version that actually adheres and penetrates. The Harvard research I referenced found that benfotiamine specifically activated the transketolase enzyme pathway in Schwann cells. These are the specialized cells whose job is to produce and repair myelin. Activation of this pathway increased myelin synthesis rates in aging nerve tissue by up to 40% over a 12-week supplementation period. 40% greater myelin production in nerve tissue that had been deteriorating for years. The researchers described this as one of the most direct examples of a nutritional compound producing genuine neural structural repair rather than merely symptomatic relief. A landmark German study published in the journal Experimental and Clinical Endocrinology and Diabetes followed adults over 60 with symptomatic peripheral neuropathy and found that benfotiamine at 300 milligrams daily reduced neuropathy symptom scores by 46% over 12 weeks, including statistically significant improvements in the most severe symptoms, burning pain, deep nerve ache, and loss of vibration sensation in the feet. 300 milligrams of benfotiamine daily taken with a meal containing dietary fat, essential for fat-soluble absorption. Morning or lunch is preferable as taking it too close to sleep can cause mild, energizing effects in some people due to the metabolic activation it triggers. Your synergy pairing is alpha-lipoic acid, 300 to 600 milligrams daily at the same meal. Alpha-lipoic acid is both fat and water-soluble, meaning it can neutralize free radicals in both the fatty myelin sheath and the aqueous interior of nerve cells simultaneously. No other antioxidant operates in both environments. Together, benfotiamine and alpha-lipoic acid have been shown in research from the Munich Diabetes Research Group to produce nerve symptom improvements more than twice as large as either compound produced individually. The full citations for all studies mentioned today are in the description. My patient Diane, 72 years old from San Diego, California, had been living with bilateral foot neuropathy symptoms in both feet for 6 years. She had tried standard B12 tablets, gabapentin, and 2 rounds of physical therapy with minimal sustained improvement. She came to me having read about benfotiamine online but wanting clinical guidance on the full protocol. We implemented benfotiamine with alpha-lipoic acid alongside sublingual methylcobalamin and P5P. At her 8-week follow-up, Diane described something she had not experienced in years, walking barefoot on her kitchen tile and feeling the temperature of the floor. That sensation, cool tile against the sole of her foot, made her cry, not from pain, from recognition, from the return of something she had believed was gone forever. That is what nerve repair looks like when you give the nervous system what it actually needs. Not management, not accommodation, repair. Your nerve fibers retain the biological capacity to regenerate myelin, restore conduction, and recover function at 65, at 72, at 80, if they are given the specific compounds the research has identified as essential to that process. The tingling, the burning, the numbness, these are not permanent features of your life. They are symptoms of a repairable deficit, and now you know what repairing it looks like. Please subscribe to this channel and share this video with someone whose nerve symptoms have been dismissed as untreatable. Every study I cited is in the description, and tell me in the comments, which of these 5 vitamins surprised you most, and are you experiencing any of the nerve symptoms I described today? I'm reading every word. Your nervous system is not done healing, and neither are you.